Halloween. Who is that guy?
1997 looked like it would be a banner year for the Pignataro family. Dr. Anthony Pignataro had a thriving medical practice, a wife, 2 children, and social standing.
That's great, Ralph.
Dr. Pignataro was also an entrepreneur. He invented and wore the snap-on toupee, held in place by 4 bolts drilled into the skull.
He's always been different, and he just came up with this idea. I could say off the top of his head, but...
I remember laughing about it. It was subject of many, many, many jokes around, you know, the family and even when he was around. But he was dead serious about it.
His medical practice consisted primarily of cosmetic surgery, which he performed in his office. One of his patients was 26-year-old Sarah Smith, a young mother of 2 scheduled to have breast augmentation. Dr. Pignataro had no anesthesiologist or registered nurse present. His only assistants were his wife and a licensed practical nurse.
Sarah Smith was feeling pain, so Dr. Pignataro ordered a little more sodium pentothal to dull the pain. When he did that, her system started shutting down, and she was losing oxygen.
At that point, he broke scrub, and I remember him tapping her on the chest and calling out her name, but there was no answer, and then all hell broke loose.
Sarah Smith was dead, the result of too much anesthesia with no anesthesiologist to monitor her, and there was no ventilator to help her breathe.
I knew that things would never be the same once this happened.
When local prosecutors learned about the incident, they conducted an investigation. They learned that Dr. Pignataro was not a board-certified plastic surgeon. In fact, he wasn't a plastic surgeon at all.
He did train for ear, nose, and throat, but did not finish. So technically, it did not make him an ear, nose, and throat doctor. He didn't finish all the things necessary to become one.
Medical experts told investigators that Sarah Smith would have survived if Dr. Pignataro had the proper resuscitation equipment.
The procedure that Sarah Smith was undergoing was a transumbilical breast augmentation. It was a very invasive procedure and should have been done in a hospital setting or a at least certified surgical area.
Dr. Pignataro claimed that deaths from anesthesia do occasionally happen. Nevertheless, prosecutors charged him with manslaughter. To avoid a trial, he pled guilty to criminally negligent homicide. He was fined $5,000, sentenced to 6 months in prison and 250 hours of community service. He also lost his medical license.